Excellencies, distinguished delegates, ladies and gentlemen, good morning. My name is Corinne Capuano. I am the Executive Director, Office of the Regional Director, based here in Copenhagen. It is my great pleasure and honor to welcome you to the 74th session of the WHO Regional Committee for Europe. It is the last session of the regional committees in 2024. It is the last one, but of course not the least one. And it is also the first time the UNCT is hosting the session of the regional committee since 2019. So for all of you who were here 5 years ago, welcome back to UNCT. I'd like to remind that this is an in-person session as decided by the 31st Standing Committee of the Regional Committee. I am pleased to say that all 53 member states of the European region are present today, and we have a very high number of participants, more than 600 participants. This is really great. In addition to all our 53 member states represented here, we also have representatives from our international partners, including UN sisters agencies, non-state actors, as well as observers, guests, and WHO staff. When you walked in this morning into UNCT, I'm sure you have noticed the exhibition area at the reception. This exhibition is showing country impact stories, and I really invite you to take a little bit of time to visit this exhibition today, tomorrow, or the day after. The country impact report prepared for this year's regional committee offers a compendium of stories that illustrate the diversity of WHO work with country, with examples of how we collaborate in familiar and new ways, and what the impact has been across the European Programme of Work, 3 priorities and 4 flagship initiatives. From engaging youth in health decision-making in Albania to advancing access to outpatient medicine in Uzbekistan, the report includes a unique example of collaboration from every member state. Each story is based on interviews with and insight from those directly involved, and offers lessons learned to inspire and guide other countries. Many thanks to the health professional, national counterparts, ministry officials, and partner representatives who contributed to this example in a spirit of trust and solidarity. Let me also thank the members of the 31st Standing Committee of the Regional Committee subgroup on WHO work at country level for their invaluable guidance in shaping the direction and co-creation of this report. Thank you. The production of the country impact report is as much an example of collaboration as the stories it contains. I really sincerely invite you to take a moment to visit this exhibition. As you might have seen, we have a new audio system in the plenary room. We are going to have a slide to show you very soon, it's here now, how to access it easily. So I'm giving you a moment to go through the slide. Thank you. Now, I would like to remind that the World Health Organization has zero tolerance policy for any form of harassment and sexual misconduct at any WHO event and WHO premises. The organization is committed to enabling events at which everyone can participate in an inclusive, respectful, and safe environment. All participants are expected to behave with integrity and respect towards each other and everyone involved in this event. If a participant has a concern, please speak to Kate Everstein. Kate is our coordinator for prevention and response to sexual exploitation, abuse, and harassment. Reports or complaints can also be made to the WHO Office of Internal Oversight Services. Their email address is investigation@who.int. WHO also has a zero tolerance policy for inaction in these cases. All concerns will be handled consensuously and confidentially. Thank you. Excellencies, Distinguished delegates, ladies and gentlemen, it is now my pleasure to invite our esteemed invited speakers to deliver their address. Their insights and leadership are invaluable as they reaffirm their commitment to health and solidarity. Firstly, I would like to invite Mrs. Japarisa Rizbekova from the Administration of President of the Kyrgyz Republic to deliver a high-level address on behalf of His Excellency Dr. Satyr Zaparov, President of Kyrgyzstan, in the context of the Central Asia International Health Investment Forum. You have the floor.
Доброе утро.
Good morning. I would like to greet you on behalf of the President of Kyrgyzstan. Distinguished participants, today we are opening the 74th session of the European Regional Committee of the World Health Organization. It's a great honor for me to welcome you here in Copenhagen at this important moment for our region. We're here to discuss critically important issues concerning protecting the health of the populations of 53 of our region's member states. Our discussions in this session will be a basis for forming future strategies and approaches which will help us to improve the health and quality of life of millions of people. At the recent International Health Investment Forum in Central Asia, which was held under my patronage in June 2024 in Kyrgyzstan, we heard calls to invest in healthcare to support development and achieve the SDGs by 2030. Health is the best investment in our common future. Economic growth and health go hand in hand. As such, we need to attach strategic importance to health as a driver of economic prosperity. Our cooperation in the field of healthcare is becoming all the more relevant and necessary. I sincerely value efforts undertaken by all member states, and I am sure that we can together achieve significant results. At this stage, as we approach the end of the European Programme of Work for 2020 to 2025, this RC74 session will be an opportunity for us to note our successes in achieving the priority goals in the last 4 years and also to look towards the future. This session is a unique opportunity to focus on priorities such as forming resilient and sustainable healthcare systems. We need to continue work to strengthen healthcare systems which can withstand constantly evolving current challenges. This includes preparing for potential pandemics and other emergencies. Second, a One Health approach. We must integrate healthcare of people, animals, and the environment. This comprehensive approach will enable us to better deal with current and future threats such as infections and climate change. Third, preparedness for emergencies and increasing our resilience to them. We need to further increase our preparedness for health emergencies and build and develop measures to respond to them, as well as increasing our resilience in the European WHO region, following the principle of considering all risk factors and the One Health approach, continuing work to create relevant national plans and systems for preparedness in responding to emergencies. For responding to emergencies, a key role in this process will be played by our emergency medical teams, which must be trained and equipped for rapid response. Fifth, innovation and new technologies. We must use all available resources and opportunities to introduce new technologies and other innovation in healthcare. I urge all of you to actively participate in discussions and develop joint decisions. Only by pooling our efforts can we achieve our goals and improve the health of people in our region. Rest assured that our country will support all efforts which seek to improve the health of our citizens and strengthening healthcare systems in our region. With respect from the President of Kyrgyzstan, thank you very much.
Thank you very much, Mrs. Rizbekova. Now, I would like to invite Mrs. Stella Kyriakides, European Commissioner for Health and Food Safety, to deliver her address in the context of 4 years' collaboration on shared health priorities to leave no one behind. Commissioner, you have the floor.
Director General Dr. Tedros, Regional Director Dr. Kluge, Ministers, honorable members. It's a great honor to be here with you today, and thank you for the opportunity to briefly share some thoughts with you in the area of global health challenges. When I started my mandate as Commissioner for Health and Food Safety, no man imagined what would follow. Facing a global pandemic, which tested the resilience of our economies and our societies. It tested the resilience of our health systems, but also showed the determination of those working in the area of health across the globe. It built a global community spirit that we witnessed with clapping for the carers every evening at 8 p.m. It was these challenges that we faced that rendered this mandate as the most defining in the EU's history in the area of health. In particular, it was the global pandemic of COVID-19 that sadly cost so many lives, that also showed us the importance of cooperation, of allegiance, and coordination. And I would like to take the opportunity given to me today to thank the World Health Organization for precisely this collaboration and solidarity in this time of crisis, and going forward with a determined way that we need to approach health now and into the future. In particular, I want to express my appreciation and sincerely thank Dr. Tedros and Dr. Kluge for their leadership and their partnership, and on a personal level, for their friendship and their trust. Our experience with COVID-19 changed the face of health and health security. In the European Union, we now have a strong European Health Union in place with a bill which is based on a number of pillars. A European Health Union with stronger health agencies, with a new cooperation framework on health threats, with proposals to reform our pharmaceutical rules, with the creation of the world's first health data space, and Europe's Beating Cancer Plan, one of the most ambitious and well-resourced plans to fight cancer in history. This is a legacy that we are proud of, and that we are keen to see develop and flourish further. The WHO has been an instrumental partner for the EU throughout this period, and you can be assured that the EU will continue to play a part in contributing positively to WHO's work. The Preparedness 2.0 strategy and action plan confirms the added value this organization can bring in improving emergency prevention, coordination, and cooperation among Euro-region countries with the European Commission. And it was this strong collaboration and support in very difficult times that led us to building on the new way of working together across all health areas. Firstly, the extremely important work on antimicrobial resistance through WHO's recent project on addressing AMR barriers, which we supported, and through the WHO contribution to the EU's joint action on AMR. Second, our joint work on the health workforce crisis with a new project on better retention in nursing. Thirdly, our critical work on vaccination. You supported our recommendation on vaccine-preventable cancers, and we launched a joint EU-WHO project to help get vaccines to those most in need. Mental health needs to remain a priority too, and we have a comprehensive strategy now in the EU, and where we collaborate closely with the WHO on our capacity building initiative. I welcome all the support in building awareness, in reducing stigma, and sharing best practices among member states. With the WHO, we have come together on healthcare digitalization, turning the EU digital COVID certificate into the WHO's global digital health certification network, where we have made universal health coverage an essential part of our global health strategy, and I appreciate WHO Europe's work to support it. Dear friends, emblematic of our close collaboration is our cooperation on Ukraine. EU member states and participating states of the EU Civil Protection Mechanism have delivered over 150,000 tons of multi-sector assistance to Ukraine. This is the largest and most complex operation to date, and 20% is directly supported to healthcare. Honourable members, the past 5 years have brought both unprecedented challenges, but at the same time have brought transformative progress in health. It has resulted in a global paradigm, a paradigm shift that should guide us all for the future. I have witnessed firsthand what solidarity, what trust, and global collaboration can achieve. And in working together with WHO Europe, we have made real strides that need to extend into the future. Dear Tedros, dear Hans, the world needs your leadership and unwavering commitment to health. I wish you courage, strength, and inspiration for the challenges that lie ahead for all of us. And you know that you can always count on me as an ally and as a friend. Thank you.
Thank you, Commissioner Kyriakides. And now, dear participants, I would like to give the floor to Ms. Katia Shish, who is a Youth for Health representative and JA Prevent NCD Youth Advisory Group Coordinator, National Institute of Public Health of Slovenia. Katia, you have the floor.
Good morning, dear distinguished delegates, and firstly, a heartfelt thank you to WHO Europe for your invitation today and continuous show of support to youth. I'm going to take you on a trip to the past so you can reflect with me on WHO Europe's journey on youth engagement. 5 years ago, there was nothing. No structures and no direct pathways in place for youth to engage with WHO Europe. Now fast forward to 2022, when a small group of 6 youth representatives, including myself, started meeting online and calling ourselves Youth for Health. It is hard to imagine that this group will grow into a network that is 200 individuals and 36 youth organizations strong today. Looking back at how nervous we were and how difficult it was to start co-creating sessions for the Tirana Health and Wellbeing Forum for Youth with certain WHO teams, it's almost laughable to comparing with what we have now. Tirana was a decisive moment in time, bringing 500 youth health advocates and WHO Europe senior leadership together in a room to kickstart the regional office's youth agenda, through adopting the Youth for Health statement, which laid the foundation for engaging youth not just as beneficiaries, but as critical partners in achieving health goals. Action began on the #1 important issue to young people in the region through the 7th Ministerial Conference on Environment and Health. I had the joy of coordinating youth efforts leading up to the event, including a series of youth-driven consultations that resulted in a youth pre-event, the Budapest Youth Declaration, and the pinnacle of our efforts, the EHP Partnership on Youth, that provides a framework for our continuous engagement and a mechanism for the implementation of the declaration. Last year, we also saw the official launch of the Youth for Health Network as an official RC73 side event, where we even had the opportunity to record a few videos explaining what meaningful youth engagement is, what are the do's and don'ts, and how to avoid tokenistic approaches. These videos now live as part of WHO Europe's internal youth engagement toolkit, which summarizes everything the WHO workforce needs to know about how to start and design youth engagement meaningfully. Other achievements I want to celebrate with you include preparing the outcome statement on primary healthcare at the previous RC, appointing an official youth representative in the Healthy Cities Network, establishing the Arid Action Youth Network, co-creating the Force of the Future Youth Conference on Immunization, and increasing advocacy efforts for member states to include youth delegates as part of their delegations, as a rise of 2 youth delegates in 2022 to the 6 we now have in 2024. Yes, and this is only 2 years and not even everything. WHO Europe is truly a trailblazer of an institution when it comes to championing youth. Today we, Youth for Health, are calling for a holistic approach to health, where health issues pertinent to us are tabled, such as mental health, SRHR and gender equality, NCD prevention, and adopting a planetary health lens. We are aware that health is not created at clinics, but rather at schools, in the streets, in parliaments, online, but especially in communities. Despite development and progress in science being at record speed, we are seeing a decrease in trust. However, evidence proves that when youth voices are at the center of decision-making, there is an increased trust of societies in science. And it's not about youth becoming presidents and ministers, but it is about equipping young people with knowledge and skills and instilling trust in them to be change agents in communities. Experience of youth, however, unfortunately doesn't always translate into current policies and systems. We need intergenerational equity, where needs and rights are balanced and policies benefit all generations. The EPW should put in focus inclusive, intentional, and mutually respectful partnerships across all levels, even providing support to member states on engagement efforts. My generation is leading the way of ambitious health and climate action. After 3 years of my own youth engagement experiences with WHO Europe, new doors were opened and many new young voices have joined. I have confidence that leadership in this space is in very, very capable hands of people younger than me, and I'm not ashamed to admit that being a youth advocate technically has an expiration date. However, being a champion of youth does not. And I will continue to support and uplift my younger peers in the future, making sure that my generation's glass ceiling is a starting point for them. Now, to bring this speech to an end, I wish you a fruitful RC and leave you with 3 R's I wish to see in the next 5 years in our region: resilient, revolutionary, and radical. Thank you.
Thank you very much for those inspiring words. Now, it gives me great pleasure to introduce a group of talented young people from Ireland called the House of Swag. You may recall that House of Swag recorded a video for RC71 illustrating how dance can be used to better our health. House of Swag entered the spotlight after participating in the 14th season of Britain's Got Talent in 2020, where they drew attention to the importance of mental health. They have gone on to perform in many countries, impressing audiences with their energy, expertise, and the strong and positive message that they give to children, adolescents, and indeed adults around the world. House of Swag, over to you.
Dance really helps mental health, and we feel like we like to promote that because I feel like sometimes a lot of people struggle with mental health, especially after COVID and stuff. A lot of people struggle with that.
The start of lockdown, that news hitting, and it was just the dread of like being stuck inside for so long, and then it was kind of like you think you have all this time, but you don't, and like everything's getting sucked, and kind of it's like nearly like a time capsule thing. It's like you feel so isolated in your little bubble.
So with this routine, we kind of start off explaining our story and how we're feeling. And basically it starts off with Jack, and he's kind of struggling during COVID, and then the news hits during this dance, and then we're still going through it. And towards the end, it still has the same impact of when COVID hit, because I feel like we never really got like a happy ending, let's say, out of COVID. It's always been Zach saying we haven't changed. It's just that maybe we're allowed to move around now, we're allowed to do certain things. Of course, we're not feel as much isolated, like Jack said, but you'll see throughout this dance that we, at the end, it's not coming to like a happy ending, it's coming to like still a sad and kind of like isolated ending, but sometimes that's what COVID still has made us feel, and we kind of want the audience to kind of see that it's okay to struggle, and after COVID, everyone probably still is struggling, so we want to show with this dance that it's okay not to be okay, and if you're still struggling after COVID, it's not just you, and it's everyone.
Obviously, resilience is really important. I remember saying to you the last time about my struggles with autism and how like that affected me going through school, and it really affected me in COVID. And I think the main thing I want to say to young people, especially people that have any kind of learning difficulties and special needs, is that no matter how hard you push, you'll 100% make it through. You just got to keep going, keep your head straight, and you can make it through any obstacles in front of you.
Excellencies, distinguished delegates, ladies and gentlemen, please give a very warm welcome to the House of Swag.
It's not that I don't want to feel okay, but no matter what, it won't go away. I try so hard, but it's just too tough, feeling like I'm never enough. I feel stuck, embarrassed, caught in shame. Why do I have to feel this pain? Can anyone see my silent fight? It feels like they were wearing blindfolds out of sight. With their eyes closed, they can't see my mind, but inside I'm screaming, feeling trapped and confined. I'm sick and tired of trying, sick of lying in bed crying, gasping for air. Why does it feel like nobody cares? I feel so alone.
We have a confirmed case of the coronavirus.
Breaking news. Tested positive for the virus. Prolonged school shutdowns, they'll be learning online. COVID-19.
Something's got a hold on me lately. No, I don't know myself anymore. Feels like the walls are all closing in, and the devil's knocking at my door. Don't you know I lose control when you're not next to me? I'm falling apart right in front of you, can't you see?
When COVID came, it trapped me inside, locked away with nowhere to hide. We ended up on our phones, our only connection, searching for comfort in a world of disconnection. Words on a screen can cut like a knife. Social media's dark side can weigh us down, where kindness gets lost and hate wears a crown.
The coronavirus lockdown has been lifted.
I'm telling these tears go and fall away.
and burn into flames. Freedom, freedom, I can't move. Freedom, cut me loose. Yeah. Freedom, freedom, where are you? 'Cause I need freedom too. I break chains all by myself. Won't let my freedom rot in hell. Hey, I'ma keep on running 'cause the winner don't quit on themselves.
When COVID ended, I thought I'd be free. I hoped for a change, a new chance for me. But my problems lingered, they didn't just fade. Still feeling alone in this mess I've made. I thought the pandemic was the cause of my pain, but I realised my struggles still stayed the same. Mental health is inevitable, but I know the damage is preventable. Talk to each other. We all need some guidance. Stop the stigma, break the silence.
So let's lift each other up and break through the pain.
Sometimes it feels like people think I'm too young, but I have feelings too, and they matter just as much. If I can keep climbing, then so can you.
Thank you. Thank you, House of Swag. That was phenomenal. Thank you so much for this amazing performance. Good luck. We will follow your future plans with great interest. On this high note, this brings us to the end of the welcome and high-level segment, and I'm pleased to now hand over the floor to my colleague, Gabrielle Jacob. Over to you, Gabrielle.